Hello everyone. In this class, we'll learn about arterial system. The learning objectives are to give the sympathetic innervation of arterial system, understand the importance of sympathetic tone in maintaining arterial volume and pressure, name the types of arteries and give their functions, appreciate the importance of Wind-Kessel effect of larger arteries, trace the arterial pulse pressure waves, and learn the principles of direct and indirect methods of blood pressure measurement. The arterial system carries blood from heart to the tissues. It consists of aorta, large and small arteries, arterioles, and meta-arterioles. These vessels have all three layers in their walls, namely tunica intima, tunica media, and tunica adventitia. Tunica media is containing smooth muscle. The tunica media containing smooth muscle is thicker in the arterial compartment than the other compartments of circulatory system. Innervation. The arterial system is richly supplied by sympathetic fibers. Sympathetic fibers originate from thoracic and lumbar segment of the spinal cord. At rest, there is a tonic discharge of sympathetic fibers to arteries in systemic circulation. This is called as sympathetic tone. Stimulation of sympathetic fibers results in vasoconstriction. Therefore, sympathetic tone is also known as vasoconstrictor tone. Vasoconstrictor tone is essentially for maintaining normal blood pressure. Increase in vasoconstrictor tone increases and decreases. Decrease in vasoconstrictor tone decreases the blood pressure. No parasympathetic innervation to the blood vessel, one has to remember. Different types of vessels. They can be elastic vessels or muscular vessels. Elastic vessels are aorta and large arteries. Quantity of elastic component is more than muscle component. Therefore, it is more compliant. These are called as also Wind-Kessel effect, Wind-Kessel vessels. That is, they act as elastic reservoirs. Muscular vessels. These vessels are small arteries, arterioles, and meta-arterioles. Quantity of smooth muscle is more than elastic tissue. Therefore, these vessels provide maximum resistance to blood flow. These are called as resistance vessels. Arterioles and meta-arterioles are the primary seat of peripheral resistance. Functions of these arteries. Arteries transport blood from heart to the tissues. Thus, they supply oxygen and nutrients to the different parts of the body. The aorta and large arteries, due to the elastic recoil property, maintain forward movement of blood during diastole. Small arteries, arterioles, meta-arterioles are richly innervated by sympathetic fibers and offer maximum resistance to blood flow. They are the seat of peripheral resistance. Therefore, these vessels mainly control blood pressure. Functional aspects. Arterial elasticity. Aorta and large arteries have more compliance due to the presence of more elastic elements in their wall. When blood is ejected forcefully into the aorta and its major branches during ventricular systole, these vessels are distended. During diastole, aortic wall immediately recoils back to its previous position, and this property of recoiling is known as Wind-Kessel effect. Due to the Wind-Kessel effect, the vessel wall that recoils back to the blood column pushes blood to move in forward direction during diastole. So this diagram showing the Wind-Kessel effect. When the blood is pumped, there will be distension of the elastic vessels, and when they recoil, they're going to push the blood column in a forward direction, and this is called as Wind-Kessel effect, and these arteries are called as Wind-Kessel arteries. Here you can see here in a compliant aorta, you can see the Wind-Kessel effect, and in a non-compliant aorta, the blood is going to move as if it is moving in a rigid tube. Arterial pulse pressure. Pulse. It is the pressure wave that travels along the wall of the arteries created by forceful ejection of blood into the arterial system during ventricular systole. The velocity of transmission of pulse wave in the wall of the artery is 15 times the velocity of flow of blood in the lumen of artery. The velocity of transmission of pressure wave increases towards the periphery. The amplitude and pattern of arterial pulse also change from central arteries to the peripheral arteries. The central artery pulse has a higher amplitude, steep ascending limb, less sharp peak, and incisura in the upper part of the descending limb, which is less steep. The peripheral arterial pulse has a steep ascending limb, sharp peak, steep descending limbs, and the diacrotic notch instead of incisura present towards the lower part of the descending limb. So these are the difference in the tracing of the pulse waves in the central vessel and in the peripheral vessel. In the arterial pulse, there are two waves, percussion wave and diacrotic wave. The percussion wave or tidal wave occurs due to the ejection of blood during ventricular systole, and this corresponds to maximum ejection phase. The diacrotic wave occurs due to the rebound of blood against the closed aortic wall during diastole. The diacrotic notch represents closure of aortic valve. Arterial pressure. It is defined as the lateral pressure exerted by column of blood on the walls of arteries. The maximum pressure recorded during systole is called as systolic blood pressure, and the minimum pressure recorded during diastole is called as diastolic blood pressure. In adults, normal systolic pressure ranges between 100 to 119 mm of Hg, and diastolic pressure ranges between 60 to 79 mm of Hg. Pulse pressure is the difference between systolic and diastolic pressure. Normally, it ranges between 12 to 50 mm of Hg. The change in pressure during systole and diastole of a cardiac cycle produces pulse pressure. The pulse pressure is high in aorta and large arteries, and it grossly decreases across the arterioles, almost negligible in the capillaries, and nil in the veins. Here you can see the pulse pressure in the different arteries. In aorta, it is maximum, and as and when it it narrows down. When it comes to the arterioles, the pulse pressure drastically is going to reduce, and in the capillary, it is almost zero. Mean arterial pressure is the average pressure recorded during cardiac cycle. It is calculated as mean arterial pressure is equal to diastolic pressure plus 1/3 of the pulse pressure. As the duration of systole is less than the duration of diastole, MAP is slightly less than the half value between the systolic and diastolic blood pressure. Normal mean arterial pressure ranges between 80 to 105 mm of Hg. Measurement of blood pressure. The blood pressure is measured directly by placing a cannula in the artery and connecting the cannula to the mercury manometer of a pressure transducer. This is the method used for recording blood pressure in the experimental animals, which is a direct method. Indirect methods. Blood pressure is usually measured with help of sphygmomanometer. The procedure is called as sphygmomanometry. In this method, Rivarossi cuff of the sphygmomanometer is wrapped around the arm of the subject. The cuff is then inflated until air pressure in the cuff overcomes the arterial pressure and obliterates the arterial lumen, which is confirmed by palpating the radial pulse that disappears when cuff pressure raised above the arterial pressure. Pressure is then raised further about 20 mm of Hg and then slowly reduced. When the pressure cuff reaches just below the arterial pressure, the blood escapes beyond the occlusion into the peripheral part of the artery and pulse starts reappearing. This is detected by appearance of sound in the stethoscope, which is taken as a systolic blood pressure. Then the quality of the sound changes and finally disappears. The level where sound disappears is noted, and it will be a diastolic pressure. Sound disappears because of the flow of the blood in the vessel becomes laminar. Methods of measurement of blood pressure. It can be measured by three methods: palpatory, auscultatory, and by oscillatory methods. Ideally, blood pressure should be measured first by the palpatory, then by auscultatory method. In palpatory method, pressure in the cuff is progressively raised and radial artery pulse is palpated simultaneously. The point where the pulsation disappears is the systolic pressure. Diastolic pressure can't be measured by palpatory method. In auscultatory method, pressure in the cuff is raised about 20 mmHg above the palpatory level, and then progressively the pressure is lowered, during which the brachial artery is auscultated for sounds by placing the diaphragm of stethoscope on it. The sounds undergo series of changes in their quality and intensity, and these sounds are known as Korotkoff sounds. The sounds are heard in 5 different phases. Phase 1, sudden appearance of faint tapping sound which becomes gradually louder and clearer during the succeeding 10 mmHg fall in the pressure. Phase 2, the sound becomes murmurish in the next 10 mmHg fall in the pressure. Phase 3, where sound changes little in quality but becomes clearer and louder in next 15 mmHg fall in pressure. Phase 4, sound becomes muffling and muffling in character during the next 5 mm fall. Phase 5, where the sound completely disappears. Appearance of the sound is recorded as a systolic blood pressure, and disappearance of the sound is recorded as diastolic blood pressure. In persons having severe hypertension, muffling rather than disappearance of the sound is taken as diastolic pressure. In children, muffling is also noted as diastolic pressure. This is how, with a sphygmomanometer, the blood pressure is recorded. After tying the reverse cuff, the pressure is increased up to more than 20 mm of Hg by palpatory method. Then the pressure is released, and when the pressure is released, uh, because of the turbulent blood flow, the Korotkoff sound appears. So that is taken as a systolic blood pressure, and gradually when you release the pressure, these sounds disappears, and that point is taken as a diastolic blood pressure. Oscillatory method. The procedure is same as that of palpatory method, but instead of palpating the artery, oscillations of the mercury column in the sphygmomanometer is noted to record the blood pressure. The pressure in the cuff is raised, and appearance and disappearance of the oscillations of the mercury column are noted. The point of appearance of oscillation gives the systolic pressure, and the point of disappearance of the oscillation gives diastolic blood pressure. So this is in brief about the arterial system. Thank you.